Hi everybody, it's Ashley of Day to Day Social Work. I'm a private online tutor and I specialize in assisting colleagues across the nation to pass their license exam in social work on the master's, bachelor's, and clinical level. You can find me online at Day to Day Social Work on Facebook, Instagram, and YouTube. So I wanted to come and do a quick video, hopefully. Hopefully it won't be more than about 10 minutes on 988. So for those who aren't aware, in July of this year, 2022, we implemented 988, which is an emergency three-digit number for people with a mental health or suicide crisis. And so I guess it's not really a lot of information, but since it's so new, a lot of people don't really know a lot about it. And so I figured I would try to be helpful and make a quick video to address some of the frequently asked questions about 988, which this information will come from the SAMHSA website. I will put that in the description box so that you can check that out on your own. So I do have another screen open here so that we can review a few of these frequently asked questions. I won't read all of them and I won't read everything word for word. I'll just give like a brief summary on some of the frequently asked questions that I think are relevant, um, or most relevant rather, and I will put the link in the description so that you can check out everything on your own. So, like I said, it started in July of 2022. They actually had a, I guess, meeting or conference that the government had, and it was virtual. So I did attend that back over the summer to just hear more about it. But of course, you can find information on it on the internet. So, frequently asked questions about 988 basics, and again, this is from the SAMHSA website. So let's see. What is 988? 988, Suicide and Crisis Lifeline. It's really the three-digit code, just like 911, but it's completely different from 911. But it's an emergency number where you don't have to remember that long 1-800 number. So I know a lot of you have probably memorized that number, especially if you've been working in direct care with people who may be self-harming or self-injurious or suicidal. You may have memorized that number. I never memorized it. So I'm glad that we have 988 because I haven't had to use it frequently. But I'm glad that we have 988 now because it's so easy to remember. So it's really the calls will port over from 988 to that 1-800-273-8255 number for the suicide hotline. So it's not a completely separate entity. So it's formally known as the National Suicide Prevention Lifeline, offers 24 hours call, text, and chat access to trained crisis counselors. Um, who can help people experiencing suicidal, substance use, and or mental health crises or any other kind of emotional distress. People can also dial 988 if they are worried about a loved one who may need support. So I've called this suicide hotline before for a family member, and our experience was good. But I've known other people who have called and it wasn't so great. So hopefully that's not the case anymore. And it's also for substance use crisis as well. So the next question is, does the 1-800-273-8255 number still work? Yes, it does. 988 is built off of that 10-digit number. So using either number will get people to the same services. Um, just 988 is easier to remember. Is 988 only for suicide related crises? It's the Lifeline. It responds 24 hours, 7 days a week, 365 days a year with calls, texts, chats for anyone who is in need of suicidal mental health and or crisis substance use challenges. And it connects those with, again, trained crisis counselors. So it's not only for suicidal people. What happens when I call 988? When calling 988, callers first hear a greeting message while their call is routed to the local Lifeline Network Crisis Center, which is based on the caller's area code. They don't use the geolocation like 911 does. It's just based off your zip code that you're calling from. So they're going to connect you with someone in your zip code that can help you with those local resources. It says a trained crisis counselor answers the phone, listens to the caller, understands how their problem is affecting them, provides support, and shares resources if needed. If the local crisis center is unable to take the call, the caller is automatically routed to a national backup crisis center. The Lifeline provides live crisis center phone services in English and Spanish and uses line language solutions to provide translations services in over 250 additional languages for people who call 988. That's good information to know. So, of course, I guess the two dominant languages obviously are English and Spanish, but because we are the melting pot, of course, they have translation services for 250 additional languages. I didn't know there were 250 languages or more. So that's good information. Um, let's see, what else was I going to say about that? Hang on. I read another part, and we'll probably get to that part that said um, that the chat is not in is English only. Let's see. Oh, okay, what happens when I chat via 988? So chatting is online, I guess. So chat, which is English only, is available through Lifeline's website, 988lifeline.org/chat. And so it gives you a link where you can go to that. Let me just click on it. I wish I could share my screen, but y'all know I'm not up to date on technology. So I can't do that. But okay, so it takes you to another page that I'm guessing that you can then chat with someone online. Okay. So let's see. People seeking chat services are provided a pre-chat survey before connecting with the counselor who identifies the main area of concern. If there is a wait to chat with the crisis counselor, a wait time message will appear. If the demand is high, people can access the Lifeline's helpful resources, which takes you to another page if you're looking on this page, while waiting. Once you are connected, a crisis counselor listens to you, um, works to understand how your problem is affecting you, provides support, and shares resources if helpful. Um, hmm. So I don't know if they meant by listens to you, they're reading your chat messages, or if they're going to put you from chat to telephone. I don't know that answer. So I'm guessing that it's just chatting. What happens when I text 988? When someone texts 988, they are responded to by a group of Lifeline crisis centers that answer both chats and texts. Okay, this service will expand over the next few years to increase local and state level response. Once you are connected, a crisis counselor listens to you, works to understand how your problem is affecting you, provides support, and shares resources that may be helpful. Currently, texting is only available in English. So the texting and chatting are English only. And then obviously, if you call 988, it's English, Spanish, and 250 additional languages. Does calling, chatting, texting 988 really help? It says almost 98% of people who call, chat, or text 988 Lifeline get the crisis support they need and do not require additional services in that moment, which is a great outcome, 98%. So that's good. Let's see, we'll skip some of these. Well, how is 988 different than 911? 988 was established to improve access to crisis services in a way that meets our country's growing suicide and mental health related crisis care needs. 988 provides easier access to the Lifeline network and related crisis resources, which are distinct from the public safety purposes of 911, where the focus is on dispatching emergency medical services, fire, and police as needed. So 988 will not dispatch someone to you. It's just, you know, an extension of the Lifeline um, No, the Lifeline hotline, hotline. Let's see. Will 988 calls be referred to 911? Currently, a small percentage of Lifeline calls require activation of the 911 system where when there is imminent risk to someone's life that cannot be reduced during the Lifeline call. In these cases, a crisis counselor shares information with 911 that is crucial to saving the caller's life. So that's good to know as well. So, and I read through this before I did this video, obviously, because I come prepared. So there is a point, there is a portion down here that tells you about if the call is being recorded. So let's see. Let's see if I can skip down to it. Oh, this is another good one. If I contact the Lifeline for help, will I be hospitalized? All Lifeline crisis centers adhere to the Lifeline's imminent risk policy, which means that crisis center staff work through active engagement to provide support and assistance for people at risk in the least restrictive setting possible. In fact, most contacts with the Lifeline are resolved by the Lifeline itself by chat or phone in a manner that does not require additional immediate intervention. So that doesn't really answer the question directly, but I guess it's just saying that um, the crisis center staff work through active engagement to provide support and assistance for people at risk in the least restrictive setting as possible. So I guess their goal is to not send you to the hospital, but they will connect you to 911 if it's going to save your life. Um, if I call 988, will the crisis counselor be trained on cultural competency? Good question. Because we as social workers know the importance of cultural competency. There are ongoing efforts to improve cultural competency training for Lifeline crisis counselors. In 2021, there were several activities addressing this, including updating pages on the Lifeline website and creating specific tools for crisis counselors, such as Spanish language clinical guidance resources, deaf and hard of hearing, best practices for callers, chat visitors, and LGBTQ plus guidance documentation, and American Indian, Alaskan Native tip sheet, and more. Okay, so they trying to make sure that they address the cultural competency needs of all people, or most people. Most people. Um, let's see. We'll skip some of these. Um, Does everyone have the same access to services provided via 988? Anyone in a U.S. state, territory, or tribe who needs suicide or mental health related crisis support or who has a loved one in crisis can connect with a trained counselor by calling multiple languages, chatting, or texting English only 988. Okay. So I guess that means yes, everyone does have the same access. As long as you're in a U.S. state, territory, or tribe. And then they further explain in the next one, is 988 available in all states and all 5 territories? It says yes. And they repeat, what I just said about, who they serve. Is 988 really a free service? Yes. Um, we already talked about the languages. Will 988 accommodate those who are hard of hearing or blind? It says the Lifeline currently serves TTY users either through their preferred relay service or by dialing 711 and then 1-800-273-8255, which is that 10-digit number. That is still in existence. Lifeline also offers services through chat and text. Lifeline is in the process of expanding to video phone service for to better serve deaf or hard of hearing individuals seeking help through Lifeline or 988. That's good to know. Um, does 988 trace the location of people who call or text or chat? When you reach out to 988, a Lifeline crisis counselor who responds to you will know your phone number if you call or text, or your IP address if you choose to chat. Beyond that, they will not know who you are or where you are located, and you are not required to provide any personal information to receive support from the 988 Lifeline. So that answers the question that we were talking about earlier, as far as like if they know your location, like 911 does, and they don't. They just know your area code that you're calling from and your phone number or your IP address if you're chatting. If a 988 crisis counselor makes an effort to gather information during a call, text, or chat, it will be to one, save lives, or two, connect people to ongoing support, and three, evaluate 988 Lifeline services. And then are there special services? Are there specialized services for LGBTQI plus youth who reach out to 988? It says yes. In fall 2022, the 988 Lifeline began a pilot program to offer specialized call, text, and chat supports for lesbian, gay, bisexual, transgender, queer, questioning, and other sexual and gender minority youth and young adults. The program aims to support people under the age of 25 who reach out to the 988 Lifeline and want the option of connecting with a counselor specifically focused on meeting the needs of LGBTQI plus youth and young adults. That's good to know as well. The specialized services are currently available by text and chat daily from 3 p.m. to 2 a.m. Eastern Time and 24/7 by calling until capacity is built up for to offer all services 24/7. Okay, so these specialized services for LGBTQ plus um, are available by text and chat daily from 3 p.m. to 2 a.m. Eastern Standard Time. So if you're texting or chatting, you have a limited amount of time to access LGBTQI plus specialized counselors. But if you're calling, then it's 24/7 access to someone specialized in that area. So then they have all these frequently asked questions about federal, state roles and funding. I'm not going into all that. I'll put the link down here. Um, and then they have frequently asked questions about call routing, privacy, network functioning, all of that. We kind of touched on some of it. Um, but I'll leave that for y'all to look at. Um, how do veterans reach the veteran crisis line? Veterans, service members, and their families can call 988 and press option 1. To learn more, please visit the website. Okay, this process is the same as it has been in the past for veterans. However, it's now simpler with the shortened 988 number. Okay. So, and this all is up to date as of October 11th, 2022 on the SAMHSA website. And again, I will put this information, the link to what I'm reading from, in the description box. And hopefully this video has been helpful for you and will be helpful for your clients, patients, friends, family members, or yourself. So until next time, I'll see y'all later.